Welcome to Forum 360. I'm Ardith Keck, your host today, and we're talking about health. Who cares about how healthy Summit County is? Who is responsible for our health? The answer to those questions is Summit County Public Health. Just as in most counties, there is an entity who answers to the Ohio Department of Public Health and helps to protect you. Here in Summit County, the health commissioner is Donna Skoda, and the director of population health is Cory Kendrick. They are with me to answer some of my questions about health and to help us understand what these organizations do. And I want to introduce Donna and Cory. And Donna, help us understand the mission of Summit County Public Health.
The mission of public health in general and in Summit County is to protect and advance the health of all the residents through policies, programs, activities, anything that we can do to help individuals be healthier.
And we're going to talk a lot more about those different things, but for now, does an individual have responsibility for their health?
Yes, individuals have responsibility. However, we want to make sure that everyone has equal access to all opportunities. So if in fact you want to be healthier, you can. And an example might be if you want to take a walk at night, if you want to be able to get out, we want to make sure there's lighting. We want to make sure that you have a safe sidewalk. If you want to purchase healthy foods at the grocery store or at a grocery store in your neighborhood, we want to make sure that those are available to you. So a person has responsibility, yes, but we also have the responsibility as a society to make sure everyone has equal opportunity for those.
That sounds pretty good to me. One of the biggest problems right now in Summit County is, and all around the area, not just Summit County, is overdoses of drugs. Does the Summit County Public Health play any role in that?
Yeah, I'll start and talk a little bit about our role. Public health traditionally is, assessment assurance and policy development. And we certainly assess an institutional problem like this, which is far-reaching. It doesn't know a race, it doesn't know a class, it doesn't know any particular group. It's just out there. And individuals, about 4 out of 5 of the individuals that report use of an opiate, an illicit opiate, a heroin, or something from the street, report being first hooked on prescription painkiller. So in public health, we're looking at ways to look at interventions with dispensing practices, that individuals know that we don't have to give 60 or 90 pills for a root canal or something pretty simple, that 30 might do it, or 20 or 10 or 5. We operate a dump program where we're able then to collect all the unused medications from the community and make sure they're discarded safely. If you look at, many individuals have tons of medications at home that are old and expired. You need to get them out of your house because that's the sort of access issues for anyone. We're also looking at, we do a naloxone program. So it's the antagonist to opiates, so it helps. We train police officers and lay persons. If somebody does overdose, then they can have that it can revive them and bring them back.
And that's being used all over the place.
Everywhere. And the idea is that it's used and that person gets then a second chance for treatment. And for some individuals, and for most of them, it's a wake-up call because you almost died. And so you are able to get into help and get what you need for the Narcan. The other thing we do is a needle exchange program. The rules changed in Ohio that public health health departments could run needle exchange programs. And we do that because not only do you have the disease of addiction, then one day you wake up and you also have a communicable disease, HIV or Hep C. And that's through the spread of using needles, contaminated, dirty needles. So we're hoping that the needle exchange, we just started that in June, catches on more. We're having, every week we have more and more individuals come to get clean needles. And then we're also doing the naloxone and Narcan. So public health has a role in the periphery. We don't do the treatment per se. We're more interested in the population piece to that.
Mm-hmm.
And Cory, I don't know if you wanted to add anything.
Yes, we have been very active in helping other partner agencies kind of track this problem through various technologies. And so we have a dashboard we put out every day now to community partners, first responders, and other city officials, letting them know the previous day how many overdoses. And as of today, there's 1,450 overdoses in Summit County for this year.
For this year.
For
Wow.
this year, which is a huge spike. And the jump really started happening, especially in July. We went from around 99 overdoses a month to almost 400 with the carfentanil and fentanyl that's been becoming more prevalent in the opiates that are being found.
That's the reason for all the overdoses, isn't it? The combination that they're putting into the heroin.
I think people don't know how much to administer, and it's causing, it's so strong. I want to say carfentanil is 1,000 times or 10,000 times stronger than fentanyl, so it's a very potent drug. Even touching it can have devastating effects.
Carfentanil is used for elephants,
Yeah,
isn't
it's
that right?
veterinary medicine only. It's not approved for any use in humans.
That's amazing. I mean, somebody's got their act messed up.
Yeah.
Obviously, the people who are using it do too, but
But I think sometimes it's unsuspecting customers get it. But then when you talk to heroin users or you talk to addicts, many times getting that next high doesn't happen because your tolerance builds. And so you'll go someplace and take something for which you know could be risky because you might get high from it.
Mhm.
So it's sort of the disease is very debilitating in judgment. So you obviously start to make poor decisions. And one of those is to experiment with carfentanil and fentanyl.
Wow. Cory, you're in charge of population health. Can you tell me what that means?
Well, population health's been kind of a buzzword for the last few years, so it can mean slightly different things. But for us, we've pulled together all the different programs in our office that can help analyze and prioritize kind of the health of the county. So we look at several health indicators throughout the county and try to create an assessment on how we're doing, and then going forward, how we can plan as a community to do a better job of improving those indicators. Another area within that is the policy, the large-scale policies, which might help shift population health. So it's looking more broadly at the entire population of Summit County and the population of specific groups as opposed to the individual.
And Live Healthy Summit is one of your programs.
Yes.
That's one of the ways that you're looking at health
Yes.
in the community.
So Live Healthy Summit,
When it started with the accountable care,
yes.
I mean, that's where it all began. Live Healthy Summit was the original accountable care. And then when
And what is accountable care?
it means that the same sort of thing, that a whole agent or a whole community wraps their supports around an individual so that they can be successful in managing their health care and their health. So if you have a community that when you're in a facility getting medical care, that's one thing, okay? And the medical care in the facility is you see your physician, you see a nurse practitioner, whomever you may see, they give you good advice and they tell you what you need to do in order to be healthy. But then when you go home, the community needs to support that as well. And if you are a diabetic, and if they prescribed you being able to take a walk to lower your blood sugars or to eat healthier foods, those need to be available to you. So to be accountable to the individuals, an accountable care community, as well as an accountable care organization. And it's just been transformed. In the original Live Healthy Summit came out of the work with Austin Bioinnovation and the accountable care community, which was really good work by Dr. Janine Janowski, and she's in Michigan now. But her work was fabulous in that whole area of looking at policy. And then we sort of, when we sort of picked that up, Live Healthy Summit became our SCCHI.
So yeah, we have a new coalition we put together about a year ago which kind of that transformed to, and that's a Summit County Coalition for Community Health Improvement. And what we've tried to do is expand that and include partners from all throughout the community. So we have private industry, a few community activists, nonprofit organizations, and government organizations, and then health providers.
About how many?
There's about 40 organizations in the coalition right now. We're always trying to expand. And currently we're working on the 2016 Community Health Assessment. So they've been instrumental in us putting together the indicators that we're going to look at for assessing the community. And going forward next year, beginning of next year, we'll be putting together a Community Health Improvement Plan, which then takes those indicators. We prioritize as a community on which areas to focus on and put a strategic plan forward on how we're going to try to accomplish that.
Okay, we're talking about health today, and with me is Donna Skoda and Cory Kendrick from the Summit County Public Health. And the reason we need to get together is that there are lots of questions about health, and we're trying to answer some of them. Talk to me about food deserts. You mentioned it to an extent. Obviously, it's something that Summit County Public Health cares about. Are you able to do anything?
Yes, food deserts exist typically in any large urban area because it used to be that grocery stores invested in the inner city and could spend, but the margins are tight in grocery stores, so they now tend to be more in the outlying areas and not so much in the inner city. And then folks are not capable of having transportation then to get there. So a food desert, not having something close to your house within a mile where you could actually walk to. And these little corner stores pop up, which are fine, but they don't carry a lot of variety and they don't have a lot of fresh foods because they spoil quickly. So individuals could be totally isolated without any real avenue to be able to go and shop. Now, also though, you can live in a very rural area that has more resources, and you can still be in a food desert, but you use your car to go get your groceries.
And not everybody in the inner city
has a
cars.
car, and so that's where it gets kind of tricky. I live in an area where there aren't grocery stores close, but I have a car. But you need to be able to build more of the smart growth where you have more of a self-contained community, where you have a grocery store, you have, and again, at the risk of sounding really old, you used to have community schools and you used to have areas where everything was sort of located more closely because people didn't have cars and you were able to secure. But we've moved away from that now, and it's becoming more difficult for many individuals to get healthy foods. We actually have, one of our projects we run is we look at how to bring fresh fruits and vegetables to the corner stores. And we actually had a grant project. We were able to purchase little refrigeration units to put in there so they could purchase apples and oranges and some fresh produce people could come in and buy. We've also looked at urban gardening and then the farmers markets, which helps.
Yeah, farmers markets, I'm sure, have helped. And gardening is something that you promote having people do.
Yes, community gardens. And I guess you just take for granted the fact that you can just hop in your car and go to the grocery store, but you go to the doctor and you say, hey, you're pre-diabetic, can you eat better? And you don't have a good options around, so it really makes the impact.
Well, yeah, and you kind of forget that we've abandoned our urban areas. Everybody's moved out, and it costs a lot more to maintain this out here than it would have been to just build that inner core. But we have lots of folks who want to live out now, but I think you're seeing some individuals return to the inner city now.
Yeah, it's happening.
It's happening, and it is good to see because that's what we're going to have to do. You can't keep supporting all this growth out here. It costs a lot in roads and taxes, and we could all be supporting more of these inner areas.
Hopefully that'll continue to happen. You have a duty to ensure food safety. And what do you do about that? Do you inspect restaurants?
Oh yeah. Every day we have 20 some inspectors out in the field. visiting restaurants, vending machines, concession stands, food trucks, cafeterias, kitchens, institutions, anywhere food's prepared, to
Wow.
assure that it is prepared safely and that there aren't any critical violations around temperature, leaving food out, spoiled food, grocery stores, you name it. We're constantly in the field, and it is full-time work for 20 inspectors a year.
And what happens if somebody doesn't pass inspection?
There's a process. We are governed by a Board of Health. Often we'll have an administrative hearing with that individual and talk to them about getting into compliance. Our mission isn't to be heavy-handed. Our mission is really to try to help food preparers do it the best they can and be safe. So we really spend a lot of time around education and effort, trying to make sure that people know how to cook, know what to do, you know.
Helping them understand.
Helping them understand. A good thing is you may make a big vat of soup and want to set that whole big pot into the walk-in cooler, when rather we'd prefer you put it in a shallow pan and let it chill more quickly, because it'll take a long time to get that core center down.
I never would have thought of that.
Well, but I mean, those are the things we try to educate on. Can you do these things, and that you don't, you know, contaminate uncooked raw meats with lettuce and things that won't be cooked. And so we spend a lot of time around education. We have an administrative hearing to try to bring them into compliance. And much to our chagrin, if in fact they will not come into compliance, and there's true public risk, we'll shut them down. We'll have to issue orders to close their restaurant until they can get it back up running safely. 'Cause
Hope that doesn't happen with my favorite restaurant.
It won't, don't worry. I'm sure it's fine. I can think of just a couple we've ever had to close because of just truly unsafe.
Cory, does alcohol counseling or smoking cessation fall under population health?
It doesn't per se the programming, but that's one of the indicators we look at as far as trends and what's going on with that. So, but that's more of our direct services.
Okay, so you do have clinics or
AOD counselors, yeah, alcohol, other drug. We have
and
8 of them.
smoking.
Smoking cessation, some with youth.
We had a baby and me tobacco-free program that we offer to mothers to try to help them quit smoking when they're pregnant. And we also work with a lot of other partners. So if we don't do it, we make sure we try to refer that client out to someone who can help in the community.
Okay.
So the health department does a lot, and like you mentioned, when most people, when I tell them I work for the health department, they say, "Oh, you inspect restaurants," and I think that's what we're most known for. But
Yeah.
we offer a ton of different things, and if we can't, we find someone in the community who can help that person out with that issue.
You also do birth and death records.
Right.
That's one of the things the health department's known for, I think.
Yeah, by state law, vital statistics.
What about communicable diseases, HIV, etc.? Do you do anything with that?
We have STD clinic. We actually operate direct clinical services for individuals wanting to get checked for sexually transmitted disease. We do anonymous testing for the HIV. We do education and outreach, trying to protect, and in a 13-county region, actually, through the PrEP project, we do some risk behavior reduction for youth. We also just received a SAMHSA grant for $1.1 million for 5 years to look at-risk youth, 16 to 24 years of age, minority youth, for alcohol, tobacco, other drug use, and hopefully reduce the risk of HIV and Hep C, because those risky behaviors often lead to poor judgment, and then you have a disease. So we have that project as well. And then with HIV, it is a concern in the youth. I mean, you have to start when people are really young and really little and help them understand that they don't want to engage in these risky behaviors.
All of these things obviously promote healthy behaviors, counseling and so forth. But in general, your statistics with communities and keeping people healthy. Does that help these organizations that are part of the Healthy Summit? Does it help them to get those statistics?
Oh, definitely. I think it's actually a lot harder to find data than you would think. With TV shows and things today, they usually tap a few buttons on the computer and they get their data. But getting health data is actually a lot harder and from a lot of different sources. So, we often provide data that others can't get, and it helps them understand the need, and also for quality improvement and quality assurance, trying to look and see, okay, is what we're doing working? So from that standpoint, we can help from that.
Mm-hmm. Is the health assessment connected to some of the other programs that you have?
It's connected to all of our programs.
Okay.
So when we're looking at the assessment and community health improvement plan, that's kind of our guiding document along with our strategic plan on how we're going to focus on our efforts.
Another aspect is vectors. I found that word on your website, and it means mosquitoes and rats and so forth.
Rats, cats, and bats.
And that's something the health department cares about, that they do something about?
Well, yes, we're concerned about vector control because of disease risk. Obviously, we all remember when West Nile came to town and we were collecting dead birds and checking and making sure. We've now expanded our mosquito monitoring to include the mosquitoes that perhaps might carry Zika virus.
Uh-huh.
And we're doing that. We've been lucky in this area. We've not had those mosquitoes previously.
Do you check the mosquito
Yes,
itself?
you collect mosquitoes, we collect them, and believe it or not, they're taken back and sexed to see if it's a boy or a girl. And then they're sent to Columbus for verification of the type.
Uh-huh.
And so we have about 11 student interns in the summer that collect mosquitoes for us out of our traps. We have hundreds of traps all over the county.
Yeah, fortunately for us, the type of mosquito that carries Zika virus, we have very few in the amount, and they don't travel very far.
Yeah.
I think
Yeah.
about a football field as far as they can travel, so they're limited in how far they can go. So if you take that, we have very few of these mosquitoes that can travel not very far, and they would have to bite someone infected with Zika. The probability of transmitting in our area is pretty low. Not to say it couldn't happen, but it's fairly low, and that's fortunate for us.
Another aspect, and you do so much, is child and family health services. And I assume you have clinics for children, for mothers.
CFHS has changed focus over the years, Child Family Health Services. We don't do direct prenatal care anymore because there are sufficient providers and there's Medicaid assistance available to women, so we make sure they get connected to a primary care OBGYN during their pregnancy. We do far more around the reduction of infant mortality, safe sleeping practices. Cory mentioned Baby and Me, tobacco-free. We do much more around the enabling services that allow a mom and baby to be healthy. Violence, anything, the infant mortality review, so that we're able then to learn from any poor outcome of a child, that we can learn from that to make system changes. So CFA, Child Family Health Services, we do run immunization clinics still for children that to make sure they get vaccinated. But again, with the pharmacy now being able to give vaccine to 7 years of age, many individuals like that 24/7 access at some of the pharmacies. So they do get many more vaccines through pharmacies, schools, other avenues, which we're fine with because we just want people vaccinated.
And you do enough.
Yeah,
other
yeah,
things,
yeah, we
so.
do. And so we just want people to be vaccinated.
And that would include the WIC clinics? Do they no longer go through the health department?
Oh, no, we have WIC.
We still have WIC, yes.
Cory manages WIC.
Yeah, and that's
Explain what WIC is.
okay. So WIC is women and infant children, and mothers, pregnant mothers, or mothers that already have children, go there for nutrition counseling, and they get a card that they can use at local grocery stores to buy formula and nutritious foods for them and their child. We heavily promote breastfeeding, but formula is on there if that doesn't work out.
Not always able to do that.
Right.
So,
Yes.
yeah. Flu. We only have a short amount of time left, but does the health department do anything about flu?
Yeah, we do much around the surveillance of flu activity to look for spikes and peaks, and we do the epicenter monitoring just like we're doing for opiates to see if in fact the numbers are rising. We provide the flu vaccine, again, to a limited number of individuals since pharmacies now do it and other senior centers. So we are able to still provide the flu vaccine. But our biggest thing is, I would say, the advocacy and trying to get people to make sure they get a flu vaccine, particularly if they care for the very young or the very old or the frail, because that is the group that suffers disproportionately.
Absolutely.
And every year in this country, 36,000 people, roughly around 36,000 people die from flu.
Thank you so much for coming today to help our communities understand the role of health departments in protecting citizens' health. Thank you, Donna. Thank you, Cory.
Thank you.
Thank you,
Ardith
Ardith.
Keck for Forum 360.
Forum 360 is brought to you with support from Electric Impulse Communications, Kim and Harvey Nelson, Rubber City Radio Group, Acronist.com, Hudson Cable, Medical Mutual of Ohio, Forum 360 supporters, and the Shaw Jewish Community Center of Akron.